Men are looking to last longer in bed, you know. So now the question is, do you even want to find that G spot which is going to make you climax faster?
Hello everyone, this is Dr. Saki. You're welcome to the first episode of Ask a Doctor. So in this segment, we are going to take questions asked by you and we are going to address them. I have with me,
I'm Dr. Kelvin Owusu, a wellness consultant from Violet Medical Center.
Nice. And like I said, I'm Dr. Saki. I'm a primary care physician. I have so much interest in health education, dispelling all the myths out there and answering your questions. So today we are going to take a few questions, right? And then we'll discuss them.
Definitely.
So pay attention, okay? Your question may be in there. So let's go straight to the first question. Okay, Dr. Kelvin, what do you say?
That's an interesting question. And the person is alive? Well, I mean, there could be a few reasons why, I mean, your blood pressure check is coming up with errors. And the first thing could be that the machine has a problem. You know, so you'd have to make sure the machine is well calibrated, it's reading properly. I mean, you can check with other people as well, make sure that it's checking rightly on those people. Then we are sure that it's not the machine fault, you know. Sometimes some machines, I mean, depending on where or how the cuff is placed, it can cause some errors as well. You know, there's the right technique to actually apply the cuff. Without seeing the cuff, the easiest thing to take note of is that the tube should always be pointing in the direction where the artery is. You know, and the artery is, if you can see my hand, is passing around this area. So make sure the tube of the cuff is along that same side, so that you get the best results out of.
So that's the inner side of your upper arm, right?
Exactly.
Okay. Yeah, that's true. When it comes to checking our BPs, right, there are a lot of technicalities to consider. Lots of technicalities. You should have rested for like 5 minutes. You should be sitting upright, or the machine should be at heart level. Quite a number of things. But then I realized the machine could actually read error for a number of reasons. Sometimes your BP is so unrecordably high
or low.
It exceeds or too low. It exceeds the parameters or the capabilities of the device. So you may want to get it checked in the hospital. Sometimes we tell people to bring your device along. We check your BP, we use hours, and then we're able to tell if it's a device problem or your BP is actually very high or very low.
I mean, I don't think it's something that you should take for granted. I mean, if you recorded BPs that are unrecordable or error, I mean, you should follow the doctor's advice. Come over to the clinic or the hospital and let's check with our machines versus your machine, and then see if there's a problem or wherever the problem may be. Because if indeed your BP is too high, you could be heading towards a hypertensive emergency. You know, that's not good news, especially in today's Ghana, where lots of young people, especially young men, developing.
You want to go there?
I know.
That's true.
So it's very important that we get it looked at immediately.
That's interesting. I would say yes, men do. What do you say?
You see, when it comes to men, as somebody described it, all that matters is that the thing is in. Where it is in, no, it doesn't matter. So long as it is in somewhere, you know. So this G spot, the fact of the matter is that most men are looking to last longer in bed, you know. So now the question is, do you even want to find that G spot which is going to make you climax faster?
No, but there's a reason why the person wants to know.
Well, I guess
it's been postulated that the prostate gland is the G spot. You know, stimulating the prostate gland can actually make men orgasm. So we should later on we'll give a brief proper description of how to locate the prostate gland.
No, but my question is now most men want to last longer in bed. If you go and stimulate the prostate gland and you are climaxing quickly, are you going to be happy about that?
So what if it's a lady asking this question?
So the lady wants the man to climax quickly. Maybe she doesn't want
the opposite
to prolong.
Maybe the man is actually lasting too long. Or they just want to explore more. So yes, men do have a G-spot. Most likely the prostate gland, and you can read more about that.
I mean, it's interesting though. The prostate gland is since this episode is airing in the month of June, where we are talking about men as well, the prostate gland is a very, very important gland when it comes to men. Only men have it, it's one of the few things that only men have. And indeed, it's also a source of distress, especially for men above the age of 40. So I mean, if you are watching this and you have a family history of prostate illness, you need to start minding your prostate every now and again, just to make sure everything is fine. So
go to the hospital for screening.
Definitely. Definitely. I mean, so now the thing is, let me take it from this angle. Balanced diet. We talk about balanced diet, but really, if you look into it, there's nothing like balanced diet per se, because the kind of diet that a person should be eating depends on what the person is doing. The kind of work the person is doing, whether it's male or female, even at what stage of life the person is in. And so when it comes to individualizing a diet plan, that's why you need to see a dietitian. I mean, I know sometimes people want to find their own ways and means of doing things, but it's important that you get professional help, because you might be eating the same thing another person is eating, but because that person is probably a manual worker. Let's take kinky. All of us go and sit and eat 2 balls of kinky. This other person is a manual worker, so at the end of the day, he's not growing, he's not putting on much weight. You eat the same thing and then you are putting on weight. The difference is that he is going out to burn the calories. You are not. You are probably an office worker. You sit in the car, drive to work,
use the elevator.
Charlie, that elevator. Then you close, sit in traffic again, head back home. So before long, you are putting on weight. Your BMI is getting out of hand, and then you are developing hypertension at 35. You are diabetic by 36, and then next thing you know, you are developing kidney failure. So it's a big deal. So you need to mind our diet as much as possible. You eat based on what your output is going to be. That this is just looking at it broadly, because we are not dietitians, so you really ought to go see a dietitian to have a more specific discussion about your the do's and don'ts in respect of you yourself. So it's very important.
That's true. You should see a registered dietitian.
Not registered,
all over the place. We have lots of dietitians or self-acclaimed dietitians.
I'm telling you.
The reason is, when it comes to diet and how your body handles food, it's so complex. Lots of controversies out there. So just be clear, see a dietitian, let them know your history, everything, your lifestyle, and all these factors you've mentioned. And then they can give you a proper diet plan. That can sustain you, and reduce your risks and all
since
that.
You mentioned controversy, there are all these diet plans out there. You hear keto today, you hear intermittent fasting tomorrow, and then you hear, Charlie, there are so many of them. Listen, yes, indeed, they all work. But the fact of the matter is that they all also have side effects. And some of the side effects can be very catastrophic. And so don't just say that because your friend did this particular diet and had good outcome, you're also going to do the same thing. You could end up in big trouble. I've had a patient develop a perforated duodenal ulcer because of intermittent fasting. So that is a crazy emergency. That's like, if you don't get to the theater within an hour, you are probably dead. So you don't want to get there.
If you need to consult a dietitian, you can hit us up in the comment section.
So I actually answered this question on the app as well. If you haven't downloaded the app yet, please find it in the Play Store and App Store, in DrDoGood. So generally, and this is a big generally, women have a lower libido than men. Now I say generally because there are some women who have very high libidos, but generally speaking, women have lower libido than men, and it's because they have lower levels of testosterone. So testosterone is the hormone that makes you, ready to go, and that's why men are always ready to go. I mean, you wake the guy up and he's ready. It's because of testosterone. So there are things that you can do, or things that make testosterone levels go up naturally, and things that make it come down naturally. And so typically in a woman's menstrual cycle, there are portions in there where testosterone naturally goes up, and that is usually around the point of ovulation. So that's why when a woman is ovulating, she's horny because testosterone has gone up, and it's nature's way of making sure that we sustain the species. So once you're ovulating, testosterone goes up, and you grab the man and you initiate, and then you get pregnant and give birth. That's how it works. So then how do you get your libido to go up? diet is very important. We just spoke about diet earlier. So make sure you are eating right, because some of the foods, especially fatty foods, among other things, can affect your hormone balance. So if your hormone is already out of balance, then obviously testosterone levels are not going to come up adequately. Manage your stress. Stress is a major mood killer. You know, so that's why when you have a deadline, you usually would not think about having sex, you know, because it has suppressed all the arousal hormones. So the stress can be in the form of money stress, can be physical stress from or relationship stress. Any form of stress can actually reduce your libido as well. Being overweight, I mentioned diet and fat. Being overweight can also affect your libido. So if you're able to maintain a healthy weight, it helps you to always, you know, have some level of testosterone in your system. And exercise. In fact, exercise is the cheapest aphrodisiac out there, and the cheapest and most efficient and effective aphrodisiac. So if you're exercising, it naturally boosts your testosterone and makes you, you know, improve your libido as well. So I mean, there are so many things that can make a woman have low libido.
So with the issue of food supplements, right? Again, a very controversial topic, because they do just what the name says, supplement your diet. So you shouldn't rely on, I think there's even indicated, as a rule, it should be indicated on the box that this does not replace a well-balanced diet or a healthy diet. So food supplements are just taken to supplement your diet and to support your diet, but you shouldn't rely solely on them. I know some people who will take their, I don't want to mention brands of food supplements, who will take their food supplements religiously compared to their metformin. Okay. Yes. That's not helping. And then also relying on food supplements and not visiting the hospital for whatever issue you have. Like I said, food supplements, someone put it that they are just going to make your pee rich, your urine rich, because most of the ingredients in them, the micro and macronutrients, your body needs them. Yeah, your body needs them in very, very minute doses, which probably your diet is giving you. So you're going to just excrete all of them in your urine, and sometimes it's not really worth the money you put in them. So for supplements, it's a controversial topic. You should go to the hospital, be assessed, and your doctor may recommend a food supplement for you. Dr. Kelvin.
I mean, I think you've said it all. The name says supplement, which means it's supplementary to something.
Right.
So if the something is not there and you're supplementing, it's kind of like redundant.
Yeah.
So you need to be eating your food, and then you supplement with
the diet,
with the tabs, with the tabs, just to give you an extra boost. You know? So if you're, I mean, and as you said, I've also encountered patients or people who are taking supplements without the main medication. That's dangerous living. So please just follow your doctor's advice. Very important. Men are notoriously terrible at taking care of their health. And that's why when it comes to a period like this, in the month of June, we try to educate and encourage men to go and get a regular routine checkup. You see, if you go for routine checkups, let me put it this way, it's cheaper to go for a routine checkup than to wait for illness. Because when you actually fall sick, you are losing on two levels. One, you are not making money, and two, you are spending money. But when you go for a routine check, you are still making money, and then you are making sure everything stays fine. And men need to be doing this more often, because if you look at hypertension in Ghana, recently the data was released, and many people are dying from hypertension. The top 10 diseases that kill people in Ghana today, 5 of them are related to hypertension.
Right.
You know, and globally, up to 80% of people who die prematurely, and premature death is defined as death before the age of 70.
Before the age of 70?
Yes. 80% is actually caused by hypertension and its complications. And men have a higher risk of hypertension than women do. So if you couple this with the fact that men don't take care of themselves, it's not surprising that men die much younger than their female counterparts. And so we need to pay a bit more attention to our health. Go for a routine checkup in this month of June. Very, very beneficial to you as a man.
No, so in Ghana, right, we have people saying that they are proud where they make statements like, I haven't been to the hospital in a while. For the past 3 years, I haven't fallen sick, not been to the hospital. Now, I think we should dispel this misconception out there. Okay, visiting the hospital is not just to treat an illness. Okay, you're in for preventive medicine, isn't it?
Yes.
Yeah. So what can you say about preventive medicine?
So I think it's the way our hospitals themselves are set up. You know, if you actually, and I have been in a situation where, I mean, in the past, when I started practicing initially, you know, especially from the government sector, where patient comes in and they say, I'm just coming for a checkup, and everybody just burst out laughing, you know. And it's because if you look at the OPD and you see people who are sick and they can't even find place to sit, then you healthy man, you avoid that. I'm coming to check out. They should put you where? Like there's no place for you to sit.
Place,
in the first place. You know, so I think this is where we need to do a reorientation. And I know that Ghana Health Service has actually started. Recently, I visited one of the polyclinics and they actually have a table for wellness.
Okay.
You know, yeah. So they start. The public hospitals have started doing something in respect of wellness, but they need to do a lot more in that regard. You know, because if it continues in the way it was in the past, then people are not likely to come to hospital for checkups when they are not well. You know, for instance, if I'm not sick, why should I come and join a queue? And that's a major complaint for a lot of people. You know, if I'm sick, I know that okay, I'm in the queue to see the doctor, but now I'm not sick and I'm waiting 1 hour to see doctor. It doesn't encourage that. So it's part of the reason why that perception has been there for a while.
Yeah, that's true. So there are lots of barriers when it comes to accessing healthcare, and this can discourage people, right? But we are emphasizing on preventive health. So we're encouraging you. So the reason why you come to the hospital is not just to treat an ailment or not just to solve an issue, but then sometimes just to, you know, some conditions are actually picked on screening.
Yes.
So we emphasize on screening. Screening means you don't have a complaint, just general population. You're trying to pick out some risk factors or some predispositions you would have.
The biggest one being hypertension, actually.
Yeah.
You know.
And something as simple as checking your blood pressure.
It doesn't even take a minute to check your blood pressure.
Yeah.
Like 30 seconds, 45 seconds, it's done.
Blood sugar, all those things. So just visit the hospital, okay? So that will be it for this episode. We can't wait to do the next episode, right? Definitely. So ask your questions on the app, okay? Put your questions there. And you can also ask follow-up questions on the ones you've already answered. Drop in the comment section your follow-up questions and we'll address it. So see you on the next episode where we'll address your questions.
Ask a doctor.
Yeah.